This is the 10th most devastating move in jiu-jitsu.
The straight ankle lock.
Tap, 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 tap. Tap, 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 tap.
So this is the straight ankle lock, which extends or stretches the front part of the ankle. The back part of the ankle is compressed, which probably isn't a very big deal. But the tissue on the very front of the ankle, which is the anterior capsule, can get torn from this.
I would say when most people straight ankle lock, it hits in the leg. And I have seen people get their leg broken right there. So when the bone does break, like when it gives way, it's probably not this bone that's going out first, at least. It's probably the fibula in the back, right?
You know, if that force is directly an anterior to posterior force, so front to back, this is the bone that bears most of that load. So if you have more of a twisting force with that, so if they're doing a straight ankle, not only coming like this, but coming in like that, yeah, for sure, you can break that fibula, the small bone. Similarly, as you're doing it, if you're going straight down, pretty hard to injure these ligaments on the outside side, like the ankle sprain ligaments. But if you're going down and to the side, those can get injured as well as that fibula. That
definitely happens sometimes.
So if it's straight down, less likely to be a big problem. If it's down and in, more like a problem.
So what about the Aoki lock then, where the heel slips? Like show the Aoki lock here, Scout. So the heel slips and he catches right there. Go ahead and apply, lock it up and put for real pressure on it. Yeah, that'll work. Tap. So for me, I started to feel that coming on here, and then I feel like a rotation through the ankle right there, but I feel like that's what breaks.
Yeah. So for me, when I feel it in the knee. So some of what we're talking about is going to be based on just each person's anatomy, the way they're made, how the training partner is putting the submission on. But yeah, so it'd be similar to this moment arm we were talking about here that bends this way. This would be bending this way, which would injure tissue right here. Basically, the capsule between these midfoot bones, it'd be what it would injure there. But if you experience it instead like this, that's going to be in the knee. That's right, because we're rotating through the whole tibia. You know, also with a straight ankle lock, if they're far enough down, kind of right down on the toes, the moment can go through here too, which injures these midfoot bones. It's called that's Lisfranc joint, since it's called a Lisfranc injury. So you can in through here as opposed to the ankle. We talked about here, the ankle, and there as well, depending on how they do it.
What if somebody just grabbed your toes and split them like that?
I don't know what would happen.
How long is it going to take me to recover if I get stuck in a straight ankle lock? I guess depending on which variation.
You're right. So again, in my mind, super uncommon, but if you break the end of the tibia, it's commonly an operation.
But what if Hector Lombard grabs your leg? It ain't that uncommon then.
Maybe not. So that's an operation with probably 6 to 12 week recovery. Yeah. So tear the anterior capsule of the ankle here and tap early enough, sore for a little while, get better.
That's a good prognosis.
Yeah, same thing with, down and in a little bit. If you injure these ankle sprain ligaments, you have experience with that. Most people do.
You hear what he's saying?
Yeah, most people do, and sore for a little while, get better. This can be a bigger injury at these Lisfranc ligaments that connect these small bones here, because when those get disrupted, that's part of like this arch of your foot, so that when you stand, it gives you that support. And so when that gets injured, those bones will collapse as you try to stand. And so many times, if those are truly disrupted, they need surgical treatment, which is a long recovery, probably about 3 months recovery there.
So don't tap.
That's exactly the opposite of my advice.
I heard what I heard. That was the 10th most devastating move in jiu-jitsu, the straight ankle lock. Number 9, what's it going to be?